Hi, this is Jeff Stafford. I'm the Chief Financial Officer of United Healthcare's Kansas Medicaid plan. I'm very proud to be working with Siobhan and her team. I think they're really onto something. The U.S. population is getting older and poorer, and that means long-term care costs are going up. Her and her team have the ability to take good science and put it right in the patient's hand to let them manage their health care, change their behavior, and lower their health care costs. And we think that can mean up to $1,000 per patient per month of lower costs, and that's pretty exciting.
Ladies and gentlemen, please welcome the CEO of Melon Health, Siobhan Bulfin.
Everyone needs help. It doesn't matter whether you're a rock climber, a baseball player, or the CEO of a startup. We all need coaching, support, and feedback so we can improve and be the best versions of ourselves. Unfortunately, when it comes to healthcare, help starts and ends in the doctor's office. We are Melon Health, and we are improving care and reducing costs with innovative, scalable, cost-effective mobile health solutions that help people help themselves. 133 million Americans are living with a chronic disease. 133 million. It's nearly half the population. And there aren't enough doctors to help them. By 2020, the shortage of doctors in the US will reach 90,000. And that's costing you, me, and everyone else in this country $1.7 trillion annually. There are lots of tools out there trying to fix this problem. Ours works. We have the customers, the outcomes, and we've generated 7 figures in revenue to prove it. People are living longer, but they're getting sicker. And increasingly, we're living alone. And chronic disease doesn't just affect the elderly. 20% of Americans between the ages of 18 and 29 have the early onset of a chronic disease. Diseases such as diabetes, COPD, and heart disease, they can't be cured, but they can be managed with care, medication, and lifestyle change. If not managed properly, they will require repeat hospitalization. We help solve that problem. We provide the patient with their coach, care team, and support crew in their pocket. We connect people with others living with the same disease. We provide them access to nurse specialists, and we keep them engaged with goal setting, symptom tracking, reminders, and their own personal coach. Meet Joe. Joe's just been diagnosed with diabetes. His doctors told him he needs to get his BMI down, manage his blood sugar, or he could end up with renal failure. He doesn't know what any of that means. He's then told he'll need to inject himself every day. He hates needles. His doctor then tells him about a program he can join to help manage his diabetes. At home, Joe downloads the app and immediately gets a warm welcome from his personal coach who shows him how it works. Getting started is easy. His first task is to identify his reason for wanting to get well. Then, with the help of his coach, he enters his goal and health stats and starts the 16-week program. Every day, he receives encouragement and positive reinforcement, as well as reminders to test his blood sugar and take his meds. He can then see his progress over time, which he can share with his healthcare provider. But the thing that Joe likes the best is being able to talk to other people going through the same thing. He can also schedule video sessions with his coach or diabetes nurse without having to download Skype, and the app comes preloaded with trustworthy resources. Joe is never without support, and in the words of one of our patients, the 2 most powerful words for anyone who's struggling: me too. But patients aren't the only ones we're helping. Health reform means hospitals receive federal penalties if patients are readmitted within 90 days, yet they have no way to influence their patients beyond the hospital setting. Medicare requires payers to show evidence of improved health outcomes for their members. And pharmaceutical companies, their biggest challenge, medication adherence. Our white label platform extends their reach, engages the patient, and empowers them to take control of their health. These are just some of the customers we're currently providing services to, such as smoking cessation, medication adherence, and cancer support. Our passionate team comprises skilled designers, developers, community managers, and doctors, and we do all our development in-house, keeping us close to the patient experience. Tonight, we are very proud to announce a partnership with United Healthcare with support from Sprint. Together, we're helping the Medicaid population of Kansas. We are Melon Health, and we invite you to join us on our mission of helping people help themselves. Thank you.